Thank you. Good afternoon. My name is Maureen Rosette, and I'm a citizen of the Chippewa Cree tribe located in Rocky Boy, Montana. I currently serve as the Chief Operating Officer at the Native Project, which is an urban Indian organization located in Washington State. I'm also a board member of the National Council of Urban Indian Health. Let me start by saying thank you to you, Chair Fernández, Acting Ranking Member Obernolte, and members of the subcommittee for the opportunity to testify on the Bipartisan Indian Health Service Advanced Appropriations Act, HR 5549. This legislation would amend the Indian Healthcare Improvement Act to authorize advanced appropriations authority for IHS. There's a long overdue need for advanced appropriations for IHS, which is the only major federal provider of healthcare that is funded through annual appropriations instead of advanced appropriations. If IHS were to receive advanced appropriations, we would not be subject to government shutdowns, automatic sequestration cuts, and continuing resolutions, as its funding for the next year would already be in place. Most recently, 3 CRs have been enacted by Congress to maintain the fiscal year 2021 budget, which has cost time and resources from IHS and our facilities that could have been directed toward pandemic efforts. For example, IHS was forced to allocate resources to reissuing individual contract and compact funding agreements for CRs twice at the height of the pandemic, when the resources could have been better spent equipping the Indian health system for pandemic response. Native Americans lost their lives at the highest rates of any population from COVID-19. And UIOs like mine need stable funding to ensure orderly operations in all our facilities to meet the needs of our patients, especially during the public health emergency. In fact, my UIO alone has experienced slow funding disbursements and still has millions of dollars of critical outstanding COVID-19 funding. A policy to provide advanced funding for IHS would have provided the stability our facilities needed during the height of the pandemic. Additionally, lapses in federal funding quite literally put lives at risk. During the most recent 35-day government shutdown at the start of fiscal year 2019, the Indian health system was the only federal healthcare entity required to operate without new congressional appropriations during the shutdown. UIOs are so chronically underfunded that several UIOs had to reduce services, lose staff, and close their doors entirely, forcing them to leave their patients without adequate care. The effects of the shutdown range from patients being unable to get vital medication for chronic conditions to fatal overdoses. For instance, one of the most limited and scarcely resourced UIOs received 7 overdose patients during the last shutdown after they were forced to close their doors, 5 of which were fatal. Advanced appropriations is imperative to provide certainty to the Indian healthcare system and ensure unrelated budget disagreements do not risk lives. The request for advanced appropriations for IHS is not new. In fact, this subcommittee has held a hearing in 2019 on this issue. Over the last 10 years, there have been 5 resolutions supporting advanced appropriation from national, tribal organizations, and national health advocates. We have also seen longstanding support from Congress and the administration. Since 2013, 11 bills have been introduced on this issue, including HR 5549. The Senate Appropriations Committee included IHS advanced appropriations for fiscal year 2023 in its fiscal year 2022 Interior Funding Bill. The House Appropriations Committee failed to include advanced appropriations for IHS in its fiscal year 2023 Interior Appropriations Bill, despite requests from members of the Native American Caucus and other members of Congress to include advanced funding for IHS. The U.S. Commission on Civil Rights report from 2018 serves as another benchmark of support by including advanced appropriation for IHS as a key recommendation to the federal government. Despite a clear need and robust support and advocacy, Congress has continuously failed to authorize advanced appropriations for IHS. Congress must act now before another government shutdown causes unnecessary hardship to the Indian healthcare system and Native Americans across the country. As such, we urge swift passage of this bill to guarantee stable funding for IHS and save Native lives and honor Representative Don Young's legacy as the original champion of this bill. While legislation is not required for advance appropriation that can be accomplished through appropriations bill, this hearing shows continued support from congressional leaders in making advanced appropriations a reality. Thank you for this opportunity to speak on this very important issue. I provided my testimony and am happy to answer questions. Thanks again.
Thank you very much for your testimony and the unique perspective that you bring, given the number of Native Americans living and receiving their services in urban health centers. The chair now recognizes Ms. Alberta Unak, who is the president and CEO of the Alaska Native Health Board. And I want to begin by thanking you for your advocacy, because we know that the ranking member and wonderful dean of Congress was bringing the voices to Congress that he was hearing in Alaska. You are now recognized for 5 minutes.